You might be surprised to learn that consuming the wrong types of nuts can increase your risk of cardiovascular disease by up to 48%, especially for seniors. The frightening part? Many people unknowingly eat these nuts, thinking they're healthy. In reality, these nuts can silently raise blood pressure, cause inflammation, block arteries, and even contribute to cognitive decline. In this video, we'll reveal which nuts could be secretly harming your health, and which ones are truly beneficial for your heart, brain, and bones. Stay tuned for the ultimate guide to nut consumption and discover the best choices for seniors looking to maintain optimal health. Number 1. Almonds. The bone-strengthening powerhouse. When it comes to keeping bones strong as we age, almonds are a true powerhouse. Packed with calcium, magnesium, and vitamin E, almonds help fight the natural bone loss that accelerates after age 65. Just a handful of almonds a day, about 15 to 20, provides a significant amount of calcium, helping slow down the decline of bone density and reducing the risk of fractures, which can be life-altering for seniors. But almonds don't just stop there. Magnesium, often lacking in the elderly, plays a crucial role in transporting calcium to the bones and preventing it from damaging arteries. Additionally, the monounsaturated fats found in almonds contribute to better heart health by lowering LDL cholesterol levels, which is essential as we become more prone to cardiovascular diseases with age. Whether eaten raw, roasted, or sprinkled in your favorite dishes, almonds are the perfect snack to add to your daily routine. But a word of caution. Almonds can be a choking hazard for seniors who have trouble swallowing, so it's important to chew them well before consuming. Despite this small risk, the health benefits far outweigh it, making almonds one of the best choices for aging bodies. Number 2. Walnuts. The brain-boosting nut. Walnuts stand out not only because of their striking resemblance to the brain, but also due to their exceptional ability to support cognitive function. Rich in omega-3 fatty acids, particularly alpha-linolenic acid, ELA, walnuts help maintain the structure and function of brain cells. This is especially important for seniors, as omega-3s are essential for effective neurotransmission and the integrity of brain cell membranes. Research shows that consuming just 1.5 ounces of walnuts daily for 8 weeks can lead to significant improvements in cognitive processing speed and mental flexibility. Walnuts are also packed with polyphenol, which help protect against neurodegenerative diseases like Alzheimer's and dementia by penetrating the blood-brain barrier and reducing inflammation in neural tissues. What makes walnuts even more special is their ability to help seniors sleep better. Thanks to the melatonin they contain, a hormone whose levels naturally decline with age, walnuts can promote better sleep patterns, helping combat insomnia and providing the rest needed for overall health. Additionally, walnuts are beneficial for heart health, thanks to their high content of arginine, an amino acid that promotes blood vessel function, and polyphenol, which reduce oxidative stress. Keeping walnuts in the fridge is a smart move to prevent their delicate oils from going rancid. Aim for around 7 to 9 walnut halves per day to reap the full benefits. Number 3. Pistachios, the heart-healthy, blood pressure regulator. Pistachios often fly under the radar when it comes to nut health, but these little green gems are among the best choices for seniors looking to control their blood pressure. With a high potassium content, around 285 milligrams per serving, pistachios help balance out the negative effects of sodium and prevent the kidneys from retaining excess salt, a common problem for older adults. In fact, regular consumption of pistachios can help lower systolic blood pressure by 3 to 5 points, mimicking the effects of some prescription medications, without the unwanted side effects. But pistachios are not just good for your heart. Their unique combination of antioxidants, including lutein and zeaxanthin, protects against age-related macular degeneration, a leading cause of vision loss in individuals over 60. These carotenoids focus on the macula of the eye, ensuring that seniors can maintain healthy vision as they age. Pistachios are also beneficial for seniors' mental health. The act of shelling them naturally slows down consumption, making it a mindful, calming eating experience. This simple process helps prevent overeating, which is especially important as seniors tend to have a lower metabolism. For those managing diabetes or prediabetes, pistachios' 3 grams of fiber per ounce can aid in regulating blood sugar levels. Aim for around 49 unsalted or lightly salted pistachios per day to enjoy their full benefits. Number 4. Brazil nuts, a thyroid-boosting superfood. Brazil nuts are truly a superfood, especially for seniors dealing with thyroid issues. Just one Brazil nut per day provides 96 micrograms of selenium, which is 137% of the recommended daily intake. Selenium is essential for the activation of thyroid hormones, which in turn regulate metabolism, energy production, and mood. Unfortunately, thyroid disorders are often overlooked in the elderly, as their symptoms are frequently mistaken for the natural effects of aging. Yet, studies show that up to 20% of individuals over 65 suffer from untreated thyroid conditions. Besides supporting thyroid function, Brazil nuts also contain fatty acids that preserve the myelin sheath around nerve cells, helping maintain reflexes, reaction times, and cognitive processing speeds. These fatty acids, combined with the rich selenium content, help to keep the brain and body functioning optimally in old age. Brazil nuts are so powerful that consuming just 1 or 2 per day can have significant benefits. They also support digestive health by promoting intestinal regularity, which is especially helpful for seniors who struggle with constipation. Additionally, their creamy, buttery texture makes them a delicious and satisfying snack, offering a natural, healthy alternative to other less nutritious options. Important tip: Brazil nuts are rich in selenium, so it's crucial not to overeat them. Stick to the recommended serving size to avoid potential negative effects from excessive selenium intake. While some nuts are incredibly beneficial for seniors, there are others that can have a harmful impact on health, especially when consumed frequently. These nuts, often seen as healthy or harmless, can secretly undermine cardiovascular health, affect blood sugar levels, and even interfere with essential medications. The truth is, many seniors unknowingly consume these nuts, believing they're doing something good for their bodies, but in reality, they may be contributing to issues like inflammation, weight gain, and cognitive decline. In the next sections, we'll dive into the nuts you should be cautious of or avoid altogether, as they can potentially worsen the health challenges that come with aging. Understanding the risks and making informed choices is key to maintaining a balanced and healthy diet. Let's take a closer look at these troublemaker nuts. Peanuts, the hidden danger. While peanuts are a popular snack, they pose a number of risks, particularly for seniors. First and foremost, peanuts are not actually nuts. They are legumes, which makes them more prone to contamination by mold and aflatoxins. Aflatoxins are mycotoxins produced by certain molds, which can damage the liver and increase the risk of cancer when consumed frequently. As we age, our body's detoxification systems become less effective, making the risk of these harmful substances even more concerning. In addition to the risk posed by mold, peanuts are also high in omega-6 fatty acids, which can contribute to inflammation in the body. This is particularly problematic for seniors, who are already at an increased risk of joint pain, cardiovascular issues, and cognitive decline. The inflammation caused by peanuts may exacerbate these conditions. Moreover, peanuts contain vitamin K, which can interfere with blood thinners like warfarin, potentially making them less effective. The addition of hydrogenated oils, extra sodium, and sugars in many commercial peanut butters only magnifies these problems, putting additional strain on an aging cardiovascular system. Even natural peanut butter, without added salt, can still increase blood pressure in those who are already prone to hypertension. It's also important to note that peanuts go rancid quickly, producing harmful free radicals, which can lead to oxidative stress and damage to the body's cells. For seniors, this can accelerate the aging process and lead to further health complications. While peanuts may seem like a harmless snack, their hidden dangers make them a nut to avoid. Cashews, the carbohydrate and glycemic risk. Despite their creamy texture and reputation as a healthy snack, cashews can be problematic for seniors, particularly for those managing blood sugar levels. Cashews are high in carbohydrates, with about 9 grams of carbs per ounce, which can cause a rapid spike in blood sugar levels. This can be especially concerning for seniors, as approximately 25% of individuals over 65 have diabetes and another 48% are prediabetic. Additionally, cashews are lower in fiber and contain higher amounts of oxalates, which can bind to calcium and hinder its absorption. This is particularly troublesome for seniors at risk of osteoporosis, as they need to maintain strong bones and ensure proper calcium absorption. Cashews may also contribute to kidney stones in individuals over 60 due to the same oxalates. Another issue with cashews is the extensive processing required to remove urushiol, a toxic substance found in poison ivy. This process reduces the nutritional value of the nuts and may leave behind trace amounts of this harmful compound. Many store-bought cashews are also oil-roasted and heavily salted, further adding unhealthy fats and sodium to the mix, which can negatively impact heart health and blood pressure. For seniors, cashews may also pose a choking hazard due to their smooth, curved shape, especially for those who have difficulty swallowing or digesting food. Additionally, the creamy texture of cashews makes them easy to overconsume, which could contribute to unwanted weight gain in an age when maintaining a healthy weight is often difficult. Macadamia nuts, the calorie and fat danger. Macadamia nuts may seem like a delicious treat, but their high calorie and fat content can pose significant health risks for seniors. Macadamias are the most calorie-dense nuts, with about 200 calories per ounce. As metabolism naturally slows with age, managing calorie intake becomes more challenging, and consuming calorie-heavy foods like macadamia nuts can lead to unwanted weight gain. Additionally, macadamia nuts are high in fat, about 22 grams of fat per ounce, much of which is saturated fat. Excessive consumption of saturated fat can raise LDL cholesterol levels, putting seniors at an increased risk of cardiovascular disease, which already becomes more prevalent with age. The density and hardness of macadamia nuts also pose a risk to oral health, especially for seniors with weakened teeth, crowns, or dental work. This can lead to discomfort and potential damage to dental work. Moreover, macadamias are often oil-roasted and salted, which adds even more unhealthy fats and sodium, making them an unsuitable snack for those already concerned with heart health and blood pressure. Although macadamias are rich in flavor, they are not necessarily the best choice for seniors. Their high fat and calorie content make them a less suitable option compared to nuts like pistachios or walnuts, which provide more heart-healthy benefits and are easier on aging bodies. Pine nuts, the medication disruptor. Pine nuts might be a small snack, but they carry a number of risks for seniors, especially when it comes to medication interactions. Pine nuts contain certain chemicals that interfere with more than 60% of medications commonly prescribed to the elderly. This includes statins, antidepressants, and blood pressure medications. These interactions can either reduce the effectiveness of medications or cause harmful side effects, creating unnecessary complications in an already fragile health situation. One of the more concerning effects of pine nuts is a condition known as pine nut sickness, which causes a bitter, metallic taste that can last for weeks. While this might seem minor, it can have a serious impact on older adults. The alteration of taste can lead to a reduced appetite and a decline in nutritional intake, which is especially troubling for seniors who may already struggle to maintain proper nutrition. Pine nuts also contain polyunsaturated fats, which are prone to oxidation, leading to the production of inflammatory chemicals in the body. This can exacerbate conditions like arthritis or other inflammatory diseases, which are common among seniors. Another concern is the small size and slippery texture of pine nuts, which can make them a choking hazard for those with difficulty swallowing, especially as dry mouth becomes more common with age. Additionally, pine nuts are calorie-dense, which can contribute to weight management issues for seniors who may not be as active as they once were. Conclusion: making the right choice for your health. As we age, the food choices we make become increasingly important in maintaining health and vitality. While nuts can be an excellent source of nutrients, it's crucial to choose the right ones to support our heart, brain, and overall well-being. For seniors, the nuts that stand out as the most beneficial include almonds, walnuts, pistachios, and Brazil nuts, each offering specific health advantages, from strengthening bones to boosting brain function and supporting thyroid health. On the other hand, nuts like peanuts, cashews, macadamia nuts, and pine nuts carry hidden risks that can interfere with medication, exacerbate health issues, and even contribute to weight gain. Being mindful of the types of nuts we consume can make a significant difference in our health as we age. By making small, informed changes to our diet, such as switching to heart-healthy, brain-boosting nuts and avoiding those that pose risks, we can ensure that our golden years are as healthy and vibrant as possible. Would you like to explore more on how dietary choices can affect aging health or discuss specific alternatives to some of the riskier nuts? As we've seen, the right nuts can work wonders for your health, while the wrong ones can do more harm than good, especially as we age. By making simple but thoughtful changes to your diet, you can nourish your body and mind for years to come. We hope this guide has helped you understand which nuts to embrace and which to avoid for better health in your golden years. Remember, every small step counts, and it's never too late to start making healthier choices. If you found this video helpful, please give it a thumbs up, share it with your friends and family who could benefit from this information, and don't forget to subscribe to our channel for more valuable tips on living a healthier, happier life. Your health journey is just beginning, and we're here to support you every step of the way. Stay healthy, stay strong, and we'll see you in the next video.